So I think we are on the dot at 7 here. So good evening, everyone. I'm Purnima Prabhakaran, Deputy Director of the Center for Environmental Health at the Public Health Foundation of India. On behalf of the hosts, the Center for Environmental Health at the Public Health Foundation of India, the Health and Environment Leadership Platform under the Center for Chronic Disease Control, our Indian Institutes of Public Health, and the Medical Students Association of India, it's my pleasure to extend a warm welcome to all the participants this evening. A very happy occasion on the occasion of the World Environment Day 2020. However, we all recognize that we are living in very unprecedented times with this global pandemic that has wreaked havoc across geographies, across the world. We have learned to live with this lockdown in India. We have learned also to get accustomed to living and moving in the virtual space. We have been inundated with information and opinions from every forum, from social media, from the televisions, and from the innumerable webinars that are being hosted across the board. So on the occasion of World Environment Day 2020 today, rather than hear from expert professionals, we thought we'd host a very unique interactive discussion, bringing together medical students and students in public health from our own institutes of public health across the country. So without further ado, let me introduce to you the webinar for today, Reclaiming Planetary Health, Youth for Health and Youth for Nature. And we have panels this evening. The first one is themed 19 perspectives from the student community in medicine and in public health. To moderate this discussion and chair the session, we have with us Professor Srinath Reddy, himself a clinician, a renowned clinician who headed the Department of Cardiology at the All India Institute of Medical Sciences, but thereafter has been the president of the Public Health Foundation of India since its inception, a globally renowned name in public health, so most well positioned to host this deliberation between students from the medical community and the public health community. So may I hand over to you, sir, for hosting and moderating the first panel on COVID-19 perspectives from the student community.
Thank you very much, Purnima, and welcome to the event. COVID-19 may seem like a zoonotic disease, but it has environmental beginnings because it is the extensive deforestation as well as the large-scale animal farming that actually creates the conveyor belt for the transmission of viruses from wildlife into veterinary population and into human habitat. Therefore, it's very befitting that we actually look at COVID-19 also from the environmental lens. But to actually share the thoughts of the younger generation who are now grappling with this challenge, which is now casting a bit of a shadow on their future because of its effect on health as well as the economy of the country, we have two young youth leaders, one from the public health colleges and one from the medical colleges. And let me invite them to first respond to a question that specifically relates to COVID-19 as it has played out in the country. To discuss this from their respective perspectives, we have Sai Krishna from the Indian Institute of Public Health, Hyderabad, and Purva Prabha Patil, who is the president of the Medical Students Association of India, who is from Manipal. So let us start off with Sai Krishna. What is your perspective now on how COVID-19 has played out for you as a student of public health? What has been your experience and what are your insights into COVID-19? And what are your perspectives on how, as a young person, it has affected you, and how do you see it playing out in the country now?
Hello, sir. I am Dr. Sai Krishna, I've done my graduation as a homeopath from JSPS Government Homeo Medical College, Hyderabad. I've done my MD also. Recently, I've joined in MPH Hyderabad at Indian Institute of Public Health, Hyderabad. COVID-19, it has shown the world the importance of public health. Whole world and actually all the industries are staggered or stopped because of the pandemic. And it has proven the need for raising the health budget allocations. Actually, it is in India, the GDP, it is only 2% of the GDP, hardly 1.8 or 2% of the GDP. Now, COVID-19 has raised the question of is it sufficient or not? And it has increased the importance of health experts. Like we are seeing Dr. Fauci from America, and actually we are seeing you regularly in the newspapers these days. It has raised the importance of public health experts, and people are seeking their advices, and media are covering their news on the front pages. And it has shown the possible opportunities for public health graduates. We have seen recent openings for public health graduates like epidemiologist posts in Hyderabad and various parts. And it has exposed actually what is a ground reality in the nation. We have seen like every time in any pandemic or any disaster, the most vulnerable people are poor and disadvantaged people. You can see the number of laborers who are walking miles together without food and water and without even footwear. There are policies which have been long pending, like one nation, one ration policy. It was it was for the pandemic to bring these policies into action, is what I felt, because during their walk, these migrant laborers suffered a lot for the food. If there was a policy like one nation and one ration, they would have got their ration at any place along their way. And the same applies to various other public health policies like ban on the public spitting. According to I belong to Hyderabad, so I know something about Hyderabad Municipal Corporation Act, in which there is a section called 488 which bans spitting and open defecation and urination in public. But nobody paid any heed or nobody paid any attention, and there was no publicizing about this act earlier. But now people have realized the importance of these kind of acts, and even central government has also passed a ordinance or law. I don't know, I mean, exactly I don't know the difference between an ordinance and law, but they have passed an order saying that spitting in public places is banned in view to contain the transmission or possible uh, spread of the viruses like COVID-19. And we have seen that people did not oppose. There was a liquor ban for 40 days, but nobody opposed it. All these days, they were very patient, and many people thought of even quitting smoking and alcohol because of this imposed ban by the government. So it is we have to rethink. I guess we have to rethink about the strategies about quitting alcohol and smoking is what I felt. And schools and colleges are closed, so schools, colleges, and even offices are closed, so everybody is forced to work online. Even we are working online. Doctors are forced to make online consultations. Earlier it was opposed by the government to make any, if a doctor makes any online consultation, but now they are promoting that. This kind of things even bring brings us to a situation where doctor is forced, doctor cannot examine the patient, and there will be more investigations. They are forced to write many investigations to the patient. That kind of burden will also be there, and there will not be any personal touch kind of feeling. Patient will lose that personal touch feeling with the doctor. And we can even expect or anticipate problems like new sedentary life, new lifestyle disorders, because of the changed workplace, changed work conditions. Earlier they used to work in offices where there were ergonomically designed chairs or ergonomically designed desks and everything, but now they are forced to work from home, where the, their convenience will not be there. So we can expect a large number of cases of cervical spondylosis or lumbar spondylosis and a like. So we have to prepare policies or make changes in our lifestyle disorders. We have to bring changes in the policies, is what I felt. And online consultations of the doctors are also becoming very popular. And as a homeopathic doctor, even I am doing online consultations these days. And there are various ways people are trying to create awareness about the corona. Most impressive thing which I felt is corona color tune. Corona color tune. By that way, like, I mean, it is a very cost effective method. Everybody is forced to listen to that alert message, like don't discriminate or don't spit in public places, or what are the wash your hands or anything. There is a caller tune played before every call. Like that, we have to reinvent or rethink about the cost effective and highly reachable strategies, innovative strategies about the corona, I mean, about various other diseases also.
Thank you.
And COVID has also exposed the lack of a proper medical infrastructure and equipment. But within 3 months, 3 or 4 months, earlier we did not have any PPE production in India, but now we are able to produce like 4 or 5 lakhs of PPEs, and cost-effective ventilators. Ideas were proposed by someone like Mahindra, who came up with the idea of ventilator simulator within 7,500 rupees. So it proves that we have unbounded potential, but a unified direction or unified guidance is needed. So someone or somebody can guide us. All in all, as a student of public health, this pandemic made me rethink about my potential and prepare accordingly to face the new challenges. Thank you, sir.
Thank you. Purva Prabha Patil is the president of the Medical Students Association of India. She is from Manipal. So Purva Prabha, as a medical student and particularly as a leader of the Medical Students Association of India, what has been your perspective on how COVID-19 has played out, both from your personal point of view and from the point of view of your association?
Thanks so much, sir, for that question. And it's safe to say that it has been a profound learning experience for all of us in one ways or the other, and in more than one ways for a lot of us. And I can say the same about myself as a medical student, and as also somebody who's involved in the leadership of the Medical Students Association of India. First and foremost, I think just for the sake of understanding, I would like to divide my response in a couple of fragments. The biggest impact that as a medical student I've felt is on my education. And I think over the last 3.5 years of me studying MBBS, I've never really acknowledged and realized the true value of my clinical postings. And this has been a time of introspection for all of us. It felt like a punishment to go to the hospital every day and just be there for 4 hours and perform all sorts of tests and examinations and history. And I think it's the last 3 or 4 months have given us enough time to look back into how we feel about that. And at the same time, it's impacted all of us very differently in terms of first years. This is a year to go out, learn more about the human anatomy, see specimens, and interact with colleagues, make friends in medical college. And it's tough. It's very difficult for first years and also for final years. With I'm myself a final year, and with the volume of syllabus that's already very stressful, the uncertainty of how we are going to kind of combat this challenge, or how we're going to write exams, or this year I envisioned that I would put together everything I've learned in the last 3 years, and it would be like a puzzle coming together. But that didn't necessarily happen because of COVID. But apart from that, I mean, there's too much to talk about how it's impacted us negatively. But then it would be a shame to not talk about the positive changes that COVID has brought. First and foremost is rethinking healthcare, rethinking the importance of healthcare in our policies, in our lives, as health professionals, as beneficiaries of the healthcare system, in terms of just how important really basic things are. in the course of our medical education, we more or less take hand sanitation for granted, which is, very basic things like hand washing, keeping safe distances, safe practices while sneezing or coughing. And just knowing that despite being such basic practices, there is such a big lacuna between the understanding of the communities we're serving. And I think that's come out really strong with the pandemic. Apart from that, I think at least I can say for people that I studied around and studied with, PSM or preventive and social medicine or community medicine was not our favorite subject. For me, it was one of mine, but that's not what the majority thinks of it. And COVID just, and I still remember having this conversation with my colleagues on why are we doing this? Why do we have to study how an epidemic is traced? We've never seen an epidemic. Likely we're never going to see one. And boom, a year later we are here, just rethinking contact tracing and why it was important, how it was done. So I think it's been an eye opener in that regard. Apart from that, it's also showed us how much strength there is if we're determined to do something. There were so many lacunae to be fixed in the healthcare system, and we have seen from not having PPE to just creating $1 million industry within a month or within 2 months and becoming one of the world's leading manufacturers of PPE. And there's scope to do so much more. And I think it's reiterated that necessity is the birthplace of innovation for us. And apart from that, also morally for me, I've always constantly been in the dilemma of I'm a medical student, I'm not a full doctor, so I don't know how much is ethical for me to contribute, but also just morally feeling that I'm a medical student, I've spent 3.5 to 4 years studying medicine, and it's a waste if I cannot be of help now. So as an organization also, we decided to partner up with the Academy of Family Physicians of India and help in contact tracing, help in data collection on changing trends in COVID, what interventions helped, what interventions didn't help, what we could do better, how we could contribute as medical students. And then a bunch of us were trained in taking online consultations, and just everything happened so quickly. But there is a lot of potential for change. And one thing that COVID taught me specifically, and also I can speak for a lot of my colleagues, is if you're really determined to do something, regardless of where, in what stage of your medical education you're in, you will always see a silver lining in a dark cloud, and you'll always find opportunities to make real change.
Thank you very much. So that's a very optimistic note. Let's hope we can carry on with that. For the second question, let me reverse the order and start with the representative of the Medical Students Association of India. We have Arpita Pava, the National Officer on Public Health of the Medical Students Association of India. She is from Delhi. Arpita, in a hypothetical situation where you are the decision maker, what would you have done differently as a first-line COVID response? If COVID had actually been spotted in India, just afresh, then what would have been your response, Arpita? If you had the decision-making power, how would you have guided India through the process of countering it effectively?
So good evening, everyone. Thank you for that question. I'd like to start off by saying that India currently has over 1 lakh cured cases, and we currently have a cure rate of about 48%, which is the highest in the world. And this is only possible because our government, both at the state and the center, took timely measures. However, as the English poet William Blake famously said, hindsight is a wonderful thing, but foresight is better, especially if it saves lives or saves pain. So despite the impressive recovery rate, we do have over 2 lakh cases, and we're the 7th most affected country in the world. So having said that, I feel that India, with a country that has over 100 medical colleges and with almost 30,000 fresh medical graduates passing out every year, I would have liked to use our existing and vast human resources better, with proper coordination between the center and the state medical councils to ensure that all medical practitioners in the country could have been mobilized. Uh, Also, Anganwadi workers and accredited social health activists or ASHAs, they form the backbone of our primary healthcare system. And in my opinion, we should have trained them and use their expertise more efficiently in contact tracing and in curbing the spread of misinformation. Medical students are always over enthusiastic to participate, and they could have been used as an asset, and their willingness to work voluntarily could have been put to good use, again in contact tracing and in fighting the various myths regarding the disease early on in the pandemic. India is also home to a variety of other alternative fields of medicine like Ayush and like Ayurveda and homeopathy. So I felt like we could have involved the Ayush sciences more instead of alienating them and considering them non-essential workers. Uh, an interesting point I felt was that misinformation we saw was very rampant early on in the pandemic. So religious leaders in our country have a huge following. So if we could have trained them to reach out to the masses and to spread proper information, I feel like the general population of India would have responded to them better. Uh, Also, we saw that during the initial stages of the lockdown, there was a lot of panic buying and a lot of hoarding of essential items, including masks and sanitizers, which also led to skyrocketing prices. So the government should have put up a system of checks and balances to ensure that no such hoarding took place, and that there was equitable distribution of these essential items, especially among the most vulnerable population. Uh, as a result of all this hoarding, our daily wage workers found it difficult to afford these basic amenities, which put them at an increased risk of acquiring the disease. People ended up buying hundreds of masks and sanitizers in bulk, which also contributed to the widespread shortage of these commodities in our country. Uh, Attacks on healthcare workers is something that has always been an issue in our country. And the same was seen during this pandemic as well, wherein doctors and other essential workers had to face unruly mobs when they went to work in various parts of the country. The ordinance that followed these attacks could have been brought in earlier to protect the frontline workers and to ensure a proper working environment for them. uh, I would like to conclude by saying that hindsight is always 2020. India has so far done reasonably well, given our population, given our economic status. But these are some of the improvements that I feel we could have made in tackling the given pandemic.
Thank you very much. We'll now have the comment from Vishak Saraf, who is doing his MPH at the Indian Institute of Public Health in Gandhinagar. Go ahead, Vishak. What has been your experience? And based on that, if you could look back and if you were the decision maker at the beginning of the epidemic in India, what kind of decisions you would have made?
First of all, sir, it's a big privilege for me to be able to speak in front of all of you. Second thing, sir, in my perspective, this is not a hypothetical. Each one of us young leaders might potentially be facing something like this in the future. We have to think about it in a way that we are planning for the future. So we used to say a few years back that the age of the great pandemics, epidemics are over. And just look at us now, 198 countries affected, every part of the world which has been left unscathed. What we have to look, sir, that what development has happened and what are the things that have been left behind since the Bore Commission came into power in 1948. It has been 72 years, but the entire COVID saga has laid bare our weaknesses. We have to realize that we cannot leave the entire onus on the doctors and the frontline workers of our country. Day before yesterday, I was looking at an article by a very prestigious publishing house about the condition of ASHA workers. And in one specific case in the state of Haryana, 4 ASHA workers had to cover 1,400 houses in a fever survey. We cannot have this kind of over-reliance on the existing system, which itself is crumbling under the weight of NCDs and other challenges. What we required right now, and what if I had the power to plan this thing, what was required at right now was to go at the baseline and make certain structural changes. Firstly, the Epidemic Act had to be amended like it's an emergency, because the act is basically a colonial vestige. It has to be modified according to the modern times. Second problem that I found with the entire response was the number of tests. By the time the scaling of the number of testing had begun, I felt that instead of one big super spreader event, which was attributed to quote unquote causing an explosion of cases, I felt that before that, a lot of cases had already started spreading into the community. Second would be immediately act as if COVID is in community transmission. Mass testing, door-to-door surveys without any stoppage. Fourth would be not only scaling up the production of PPEs and other equipments in our country, we had to get more of them, stock them up, right from the point when the disease started going international. We knew that this point will arrive, that we'll have 2-3 lakh cases in the country, a mortality rate of 5,000. The most important thing which I feel right now is the left behind cases, the all-cause mortality survey, which has to be started at some point. We have to see what deaths are being missed out. Who are these people who had been turned away from the hospitals just because they were not exhibiting the typical signs and symptoms of COVID-19? Again, the very nature of COVID-19 itself has caused a major challenge to the entire medical fraternity. It is a disease unlike anything. We have heard of cases with O2 stats going to 60-70%, just sitting up on the hospital beds as if nothing is wrong with them. And then we have had people, if I have to quote, a case of a Delhi policeman who got diagnosed on Sunday and he died on Tuesday. With a disease like that, we have to have a hands-on, very, very proactive emergency approach, which I felt our government did not initially have. Another thing would be the opening up process. So the containment policy that is being followed by the government is robust. So is the contact tracing policy. But I feel at the moment, there are reports, for example, coming in from Mumbai, where the ASHA workers and other frontline workers are actually skipping houses because how overworked they are and how overstretched they are. So again, the whole point here is that we have to turn our entire health system into a war footing. And that is something I would do differently. Considering how environment is changing, I'm pretty sure that any of us, or maybe all of us, might be grappling with the same issue 20 years down the line, with another novel virus shaking the very foundation of our healthcare system. Thank you so much.
Thank you very much. That was a wonderful exposition by both the medical students as well as the students of public health. Clearly, India has faced a major challenge, and it has exposed both our deficiencies and strengths. The deficiencies have been outlined in terms of a weak health system, particularly at the level of primary health care, even in hospitals, the overworked staff, whether it's doctors and nurses, or in the field, whether it's the ASHAs or other primary healthcare workers, all of them currently suffering from an excess load of work and unable to actually meet the challenges of increasing demand on their time. At the same time, we have also seen some of the negative features, as have been mentioned, of shortages of equipment, as well as hoarding of essential personal protection equipment. And all of these have also caused some concerns. There have been some mentions about how the medical practice has changed into telemedicine, distancing the doctor from the patient, with the potential for more unnecessary tests being ordered and so on. But we have also seen the positives that have come up. We have seen the resilience in which we have actually now started developing our capacity for production of many of the medical devices as well as the pieces of personal protection equipment, and therefore long neglected self-sufficiency in these areas is being restored. We have seen, as has been rightly pointed out, a greater awareness of the importance of the health system overall, but particularly of public health. There's a greater consciousness of even simple things like hygiene at the personal level, but of also necessity to actually implement laws and regulations that have been long forgotten, whether it is spitting or other types of regulations that have been talked about. So there has been a change in the way public health is being perceived and health systems are being perceived. But there is also a recognition that we are paying the price for considerable neglect of the past, because a health system which is under-resourced, both financially and in terms of human resources, cannot suddenly build up a surge capacity. Despite the heroic work being done by our healthcare staff, whether in hospitals or in primary health care, the fact remains that we have actually neglected our health system for long. And this is where now correctives must be applied on a wider scale. And it's been rightly pointed out that it can't be the effort of the healthcare team alone. You have to bring in citizen participation as well as other streams of healthcare. Ayush has been mentioned, religious leaders have been mentioned, citizen representatives have been mentioned. All of these sections will have to now unite into a common front in order to provide a sufficiently robust response to this particular epidemic. So building these coalitions and partnerships at the community level is also going to be extremely important for us. And I'm very happy to note that the medical students and the public health students are both looking at this not merely as a depressing challenge, which is going to be dousing their spirits, but as a challenge that they would like to meet as able young leaders who are creating the way for a healthy future for India, recognizing some of the problems, but also trying to think of solutions for it, and ensuring that in future, if there are challenges, their own creativity and readiness to respond will come into play. May I just leave on a positive note? It's been mentioned that we have the 7th largest number of cases in India. One of the things that we must learn, whether it is in PSM or in public health, is that any number like that needs a denominator as well. When you actually put that number in the numerator and when you put the population of India in the denominator, we find that the number of cases are not as many as in many other countries when you adjust for the population. But that doesn't mean that we should be relaxed or negligent, but we should actually ensure that our numbers of cases can be contained, our death rates will be low, and certainly we must prepare our health system overall, whether it is a broader public health system or the healthcare system which provides individual care, become much stronger over the years, better resourced financially, with better human resources. But most important is to ensure that we build in partnerships with other sections of society, especially the people, so that we can advance public health and healthcare in the right manner, so that we can prevent epidemics as well as handle them with speed and success if they do occur. But thank you very much for the bright minds and for the excellent contributions you have made.
Thank you very much to the panelists, both from the public health community as well as the medical students. Thank you, sir, for hosting and moderating that discussion. There are a few comments in the chat box. I'm not sure whether I should direct it to you. We could take about 5 minutes. There's one question asking, why are we not using a horizontal approach to deal with this pandemic? Different states are facing different issues, and a population-based approach for prevention. We still seem to be more focused on curative care.
Well, basically, if by horizontal approach you mean that each state should be able to take its own decision rather being guided entirely by central policies or diktat, I would agree with you. Certainly in the face of a new pandemic, particularly when flights are coming in from outside, bringing in potentially virus-infected persons, there has to be a national policy that has to set in motion. And the response has to be organized at the national level through center-state consultations. But as the epidemic advances, certainly you need to actually move to the state level and then into the district or even the sub-district level, where the decisions will have to be made on data collected and analyzed as close to the field as possible. So having policies made at the central level, planning at the state capital level, but execution or implementation at the district level, or even actually at the ward and village level would be the ideal way to go. And even if we had begun with a slightly top-down approach, this is the time for us to decentralize. Decentralization with coordination and consultation.
Thank you, sir. There was one other comment on, do you think the trust in a globalized world will reduce or has reduced post-pandemic? I mean, that's more a comment, but if anyone just wants to respond to that, more as perspectives from the youth too.
Yeah, I think it's the young people who should respond, because they're going to be actually living in the world longer than we are. So they must
I'll put that
their
out
perspective.
to you. Yes, yes, sir. So Purva or Sai Krishna, Vishal, does anybody want to respond to that?
I can attempt to take this one.
Yeah.
Now, in terms of, and this is me providing my perspective on this question. In terms of trust in a globalized world, it will be a yes and no both. Considering that we have seen certain failures in globalization, especially amidst this pandemic. But we've also at the same time seen opportunities of collaboration, cross-country collaborations, and one country cannot have all resources that it needs to sustain human life. It may be at the basics, yes, but if you were to talk about rapid development and growth of the country, it's always, there's always more scope for it when it's being done with bilateral or multilateral exchanges with other parts of the world. This pandemic has also taught us that we have strengths and we have weaknesses when it comes to talking about globalization as a whole. I mean, it's a very big term to directly just say yes or no. But I think we've highlighted what works and what doesn't work. So maybe in terms of what doesn't work in this globalization era, are opportunities for us to fix them as leaders of the future, because we have seen what has failed potentially, especially in terms of the lives lost, mistakes, the cost of the mistakes that we made just while being the most globalized version of the world we've ever seen. And also to capitalize on the good that's come out of it, to capitalize on the learning experiences that have been shared, also to capitalize on just how much has come out of collaborating on both humanitarian basis as well as on more business and non-humanitarian basis as well.
Well said.
Yeah, I agree. Very well said, Purva. So 1 minute left on this panel. So would you, the public health representatives, want to add from your perspective?
Yeah, hi ma'am. So I would like to take this. So at the risk of delving into real politics and geopolitics, I would like to say that we are already part of a very, very multipolar world with a very nice gentleman taking the helms of the United States, and China kind of dominating the entire global scene. What I feel is that with the coronavirus spreading and the world becoming more insular, we might look at a major shift in geopolitics, in the sense that globalization might not crumble entirely, but at some level it might morph into something more localized, as if say one country in a specific region might become more prominent or more powerful, and that might be it. Like, not many countries might have the resources or honestly the geopolitical strength to exert themselves internationally as they once could. Globalization basically ran on the power of Bretton Woods, which was instituted when a post-war America took helms of the entire world and faced off with the Soviet Union. The days of the superpowers are gone. Even China, the world's financier, is being looked up as some sort of a culprit in this entire situation. Definitely, the trust in globalization will wane. Definitely, it will wane. But we have to realize that we cannot just do away with an interconnected world. That's just how humankind works. We need each other. So that's my 2 cents on it. Thank you.
So any closing thoughts?
No, I think these are stimulating thoughts. Some of the thoughts could actually be subjects of a debate, but I believe that we will require global solidarity to face common global threats. But even in that environment, we need to be fairly self-reliant as much as possible. You cannot be euphoric about globalization and depend entirely on imports of essential goods, whether it's medicines or other elements. So I think we bring a better balance into our understanding of globalization. A Portuguese writer called Miguel Targo said, universal is local without the walls. So a lot of action will have to be local, but we have to break down the walls so that knowledge can flow freely and global solidarity can assert itself when there are common global threats.
Thank you so much, sir, for summarizing that. And I'm really thankful to all these representatives from the student community, both from the medical field as well as from our public health institutes. It's really refreshing to be on a webinar like this and hear from younger voices. I mean, we've been flooded with webinars where we're hearing from expert professionals. So we were really excited to host this one with